the nations of the world had a vision. After years of war, they realized that it was better to work with each other than fight with each other. They realized that a healthier world was a safer world. Their vision was clear, but bold: the highest possible standard of health for all people. They debated and agreed what this organization would be and do in a document called the Constitution of the World Health Organization. Tomorrow marks the 75th anniversary of the day that Constitution came into force. The WHO Constitution was the first document in history to formally recognize health as a human right. Since then, the world has made significant progress towards realizing that vision. Life expectancy globally for both sexes has increased from 46 to 73 years, with the biggest gains in the poorest countries. Smallpox has been eradicated, and polio is on the brink. 42 countries have eliminated malaria. The epidemics of HIV and TB have been pushed back. 47 countries have eliminated at least one neglected tropical disease. Just in the past 5 years, new vaccines for Ebola and malaria have been developed and licensed. And for the past 3 years, WHO has coordinated the global response to the COVID-19 pandemic, the most severe health crisis in a century. We cannot claim sole credit for these achievements, but we have played a leading role in all of them. And although we have many achievements of which to be proud, we still face many challenges, some old, some new. Non-communicable diseases now account for more than 70% of all diseases globally. Rates of diabetes and obesity have increased dramatically, driven by unhealthy diets and physical inactivity. Progress against malaria and TB has stalled. Antimicrobial resistance threatens to unwind a century of medical progress. Air pollution and climate change are jeopardizing the very habitability of our planet. And as COVID-19 has exposed so brutally, there remain serious gaps in the world's defenses against epidemics and pandemics. For all these reasons and more, the world needs WHO now more than ever. WHO also today launched a new campaign to improve emergency care training for nurses and midwives. Nurses and midwives play a key role in emergency situations. When emergency care is delivered well, the chance of surviving an injury or life-threatening illness increases dramatically, while the risk of a long-term disability is significantly reduced. To provide high-quality emergency care, nurses and midwives require high-quality education and training. Our new campaign is called 25 by 25 by 25. Our goal is to support 25 countries to train 25% of their nurses and midwives in WHO's basic emergency care course by the end of 2025.
There's always investigations that happen in that market. And we know that samples were collected. We've seen the data now where that exists. The challenge is that data was collected in January, February 2020, more than 3 years ago. We have asked repeatedly in the March 2021 WHO-China joint report, there are recommended studies that are in there. And to this day, we don't know if those studies have been conducted. SAGO published a report in June 2022 outlining studies that need to be done, and to this day, I cannot tell you if those studies have been done. And with regards to the lab, there's lab audit data that can be evaluated and needs to be evaluated. So then, as the Director General has said many times, so that the hypotheses that are on the table can be evaluated and assessed, and either we keep going with them or we're able to take them off. But at the present time, we can't take any of those hypotheses off the table. We have requested from the United States the reports that they have, where they've made their own assessments. Not only the reports, the latest one from the Department of Energy, but the data underlying those reports. If some of these studies haven't been done, then for some of them, and in particular studies of the animals in the market, serosurveys, it's too late. But it's possible that those studies have been done, and if they have, we are asking for that information to be reported to us, to be shared with us, so that it could be discussed with SEGO.
The first step, which was a milestone, was the agreement of the member states to have a legally binding agreement, which is very crucial. And second, they have opened up a very open, transparent, and inclusive process, and many stakeholders have already contributed, and that's why the zero draft is very rich. This week, there are areas where progress has been made, and there are areas that need continued engagement and negotiation. But in general, I think there is readiness by the member states. There is no difference actually on the need to have an accord. And on the content, at the end of the day, I believe they will come to a balancing act that will address the important issues and make this document as good as possible.